All right, and I believe that we have the AIIMS director, Dr. Randeep Guleria, with us in the broadcast. Appreciate you, sir, for taking the time off day to be with us. Good evening, Dr. Guleria. Appreciate you being with us on NDTV. I have to begin by asking you, we're conducting this interview in a week where India's crossed the grim milestone of over 5 lakh cases. The big question on everyone's mind is, when will India's cases peak?
So that's a tough question, and I feel that we will peak at different times in different parts of the country. There are certain areas where I think we have showing a downward trend, whether it be cities like Ahmedabad or Pune. Places like Delhi and Mumbai will peak, I think, over the next few weeks. And we may have some areas which may peak much later on. So it's going to be a varied sort of peak as far as we go, as far as the country is concerned.
All right. So varied peak as far as the entire country is concerned. But, there were many who said that July will be among the worst months when it comes to the coronavirus. Do you stand by that, looking at the current numbers?
So I think so. We will see an increased number of cases as we are seeing right now as far as July is concerned. But my concern is not the number of cases, because considering our population, we will definitely have large number of cases.
Right.
After all, many countries in Europe constitute what is the population of India. The important thing, I think, is that we must keep our mortality low. We must have our healthcare facilities ready. We must be able to manage the load of patients if that increases. And as of now, we've been able to do that. And I think that is the most positive thing, that even if we have a large number of cases, but the deaths continue to be low, I think we would have succeeded as far as managing the pandemic is concerned.
In the initial months, it was said that the summer may be able to bring down the number of infections. That, of course, didn't happen. We're now entering monsoons. In fact, monsoons covering India 10 days in advance. How is the monsoon or the rains, going to impact the pandemic?
So you're right. When summer came, people felt that now with the heat, the virus will die and we will have a decline in number of cases. That did not happen. So it's difficult to say what will happen with monsoon, but I don't think that the monsoon will cause any decline in number of cases. There's been a concern that will we see an increase, because influenza per se tends to show a spike during the monsoon months. But this is a new virus and we really don't know much about it as far as the seasonality is concerned. My fear is that in the monsoon months, we will have a lot of what we call vector-borne diseases, like dengue, chikungunya. And they also present with fever, body aches, and therefore it will be a challenge then to differentiate COVID-19 infection from a person who has come with fever and body aches and has dengue. And that will lead to a strain not only in the hospital, but for clinicians to be able to differentiate between the two illnesses.
All right. So the monsoons could, in fact, further increase the challenges is what you're saying. But, just to come back to the question of when will India's cases peak? And you said that there'll be a different peak in different parts of the country. But is it possible that there could be, 2 different peaks? For instance, what we saw in the US, hitting a grim new record of COVID-19 cases after the peak, which many believe was in April?
So in the US also, the peak actually happened predominantly as far as New York was concerned, and the cases came down because of a decline in New York. But also then a lot of events happened which led to decrease in social distancing. People were not wearing masks, and this led to a further spike, or well, you could, I won't say it's a second wave, but another increase as far as the number of cases is concerned. And this actually points to a very important factor, that even if the cases continue to decline, we cannot let our guard down in terms of social distancing, in terms of wearing a mask, in terms of hand washing. And this has been shown in past pandemics also, even in the 1918 pandemic. When people started doing the social distancing and wearing their masks, there was a second peak. And that was larger than the first peak because of the fact that people really did not understand the importance of all of these measures, which have to be continued for many, many months.
Right. There's a question that one of our viewers has asked online. Actually, 2 of our viewers have asked online, when will the pandemic end? Is there a definitive date? Is there a timeline that you have in mind?
So I don't think the pandemic will end in the terms of actually going away by the end of this year or early next year. We will come to a new normal where we will continue to have some cases of COVID-19, but there will not be that many, and it will be manageable both for the healthcare facilities and in terms of being able to come back to a new normal life or a near normal life. But I don't see that it will suddenly go away in 2 months' time. The number of cases will decline, but we will continue to have few cases with spurts happening off and on, as we're seeing in China or in other parts of the world which have had very few cases, but then some cases have come after a few weeks also. Even in New Zealand that has happened. So that will continue to happen for many months, even in our country.
Right. Dr. Guleria, at the GOM today, it was once again reiterated that, there are 8 states that account for 85.5% of the cases in India. Does this mean, that there is community transmission in these 8 states?
So in these 8 states, wherever you have these hotspots, it is likely that some degree of local transmission is occurring, and that is causing the increase in the number of cases in these areas. As a nation, we're not having community transmission. But it also highlights the fact that we need to really work aggressively in these areas in terms of isolation, quarantine, testing in earnest. And people have to understand the responsibility in these areas, because these are the areas where the cases are rising dramatically. And unless we do something aggressive here, the cases will not come down and our peak will get more and more extended.
Right. There was a fair bit of a controversy that took place in Delhi this week, with patients refusing to share an ambulance with other COVID patients. Can a patient contract a more virulent strain of the virus by traveling or sharing a space with another infected patient?
No, not really. Currently the virus itself is the same. It has not changed so much that we have different strains circulating in the same city or in the same part of the world. Therefore, I don't think that that is an issue. If the patients are stable, if they are mildly symptomatic, they are stable, they could travel together. And in many hospitals, when you have common wards, you have patients who are staying, who have the illness and are admitted in the same ward. So it's the same thing as it is an ambulance. You're staying in the same room together. It's not that you are going to get a different virus or different COVID than the patient in the next bed. You're all in the same common general ward.
Right. I think a lot of those myths, therefore, need to be clarified and dispelled. India's recovery rate is touched 58%. But as people recover, there are many, of our viewers who are actually sending us these questions on what happens, after you've recovered. Can you get it again? The pandemic is not over. What are chances of a relapse, doctor?
So the chances of getting the infection again are low. Currently, whenever you have an infection with any viral pathogen, especially the respiratory virus, you do develop some degree of immunity, which leads to the antibody formation, and that is the basis of giving the plasma therapy also. These antibodies give you some protection, and therefore the chances of getting the infection is low, or even if you have an exposure, the chances of any serious illness is very, very low. How long does this protection last is something that is not very clear, because this is a new virus. We don't know how long these antibodies persist in the blood and how do they behave. The immunity may last for a few months, it may last for a year, but that data will emerge only with time. But yes, once you have the infection, the chances of you getting the infection again are very, very low.
Right. I think you've answered part of that question, but that was a question that was sent to us by a recovered COVID patient. How long does it take for the antibodies to form? And, how long do these antibodies stay in your body?
So we're trying to evaluate that. What we've found is that the antibodies usually form after after 2 to 3 weeks of your having been tested positive. And that is why, if you remember, when the antibody test came, it did not do very well, because the antibodies are not present in the early days. And that's why when the antibody test was used early in these patients, they were not being picked up.
Right.
What we found is that usually after the 2nd to 3rd week, you start developing antibodies which can be picked up. And we are trying to follow up these patients to see how long do these antibodies last in our patients. It seems that they do last for at least 3 to 6 months, but I don't think we have enough data to be very sure about this.
All right. As Delhi crosses the 80,000 mark today, there's a SERO survey that is being conducted. Dr. Guleria, what should people living in Delhi expect from this survey?
So this survey will also tend to answer one of the questions that you asked me previously, that is there some degree of community spread happening? because this will tell us how many people have had the infection, have recovered without being diagnosed or being tested. So by sero surveillance, we would get an idea as to what is the what is the positivity rate in our community of those who have got the infection and recovered, even if they have not been tested. And it will give us an idea as to what is the underlying positivity in the community. If you have a high positivity, that would suggest that significant number of people have had the infection and recovered, and therefore that is a good sign, because that would mean that the large amount of people have got infected and been cured, and therefore the spread of infection will come down to a large extent.
Right. This week there have been, different things happening all over the country. Guwahati has gone into a 2-week lockdown. Chennai, Madurai, we discussed this last week as well, have been in lockdown. Hyderabad markets have shut voluntarily. This is Delhi and Bombay seem to be relatively more lenient. What, according to you, is the best strategy? Periodic lockdowns, or, do things like sero surveys to be able to better fight the virus?
So if we are looking at a strategy in especially hot zones or where there are increasing number of cases, I think testing, tracing and isolation are very, very important. You have to identify areas by looking at your map and looking at the cases which are coming, clusters, and develop a strategy of limited lockdown there, aggressive containment strategy, so that the infection is brought down in those areas and it doesn't spill over to other areas. By doing that, only one will be able to contain the spread of infection. And if that means having a limited lockdown in some areas, I think that should be done, because that will prevent the infection from spreading in that area and going on to other areas. But whenever you have this, it has to be implemented properly. By just doing a lockdown and then people not following it will actually defeat the very purpose of a lockdown.
Right. So you're essentially saying it has to be a combination of different things. The Health Ministry has added a steroid called DEXAMETHASONE in the COVID-19 treatment protocols. Dr. Guleria, what more can you tell us about it?
So as far as treatment protocols were concerned, we were already giving another steroid, methylprednisolone, and there was data to show that in COVID, because it causes a cytokine storm, it's useful. More recent trials have shown that dexamethasone can actually help in moderate to severe cases in decreasing the mortality, and it's also a steroid preparation. It's much more cost effective, it's easily available, and therefore the guidelines have added both, that you can either give methylprednisolone or dexamethasone in the management strategy, because there is now evidence to suggest that it may actually decrease mortality and sick patients may have a better chance of recovery.
All right. So it could decrease mortality. That's very crucial. But, since we're talking about potential cures, the launch of Patanjali's CORONIL this week created a lot of controversy, raising, larger questions on whether alternative medicine or Ayurveda could present themselves as potential cures.
So I think I'm of the opinion that we should not really discard anything without having evidence, but evidence is definitely important.
Right.
There is data which suggests that Ayurveda and alternate medicine can improve an individual's immunity, but does it have an antiviral effect is something that we need to really evaluate critically, because we know that a large number of patients with mild illness recover on their own without any treatment. So even if you gave them a multivitamin, they would recover, and by saying that the multivitamin cured them would not be a correct statement to make. So therefore, whenever you try some new method of treatment, it must undergo rigorous clinical trials, so that you can show without a doubt that the improvement occurred because of that medication rather than spontaneously, as can happen in mild cases.
Right. Speaking of the efficacy of medication, Remdesivir was approved for COVID-19 treatment, but it's been priced very highly at over 5,000 rupees per vial of the drug. And, we're told that 6 vials need to be given, 6 doses need to be given. Do you feel that the price of the drug makes it unviable to the sheer number of people who might need it?
So the dose is for 5 days, and the cost is slightly on the higher side. But I think since it's a drug which is currently marketed by an international multinational which holds the license, Gilead, in my mind, if you look at the international cost, the cost in India is still much lower than what it is in the international market.
Right.
I am of the opinion that once it starts getting used extensively and there is a big demand for it, the price should further come down. and that will be easier for the manufacturers also to bring it down, because if the demand is good, then it would be reasonable for them to bring the price down.
All right. So very crucial, price point question there. But Dr. Guleria, as you know, NDTV started a campaign on plasma donation, encouraging potential plasma donors to come out and donate a plasma to save a life. Tell our viewers a little bit about, the efficacy of convalescent plasma therapy in curing COVID-19.
So convalescent plasma is one form of treatment which is an add-on treatment to what else you're giving as far as treatment of COVID-19 is concerned, and it's usually useful in moderate to severe cases. This is basically when you're giving a person's plasma which has antibodies, like we just discussed, to the person who is sick, and these antibodies actually boost the person's own immunity till his own antibodies are formed, and they therefore help in fighting the virus early on. Two things are very crucial. One is that the plasma should have sufficient antibodies, and it's important that the plasma be tested to see that it is safe and it has sufficient antibodies. Also, it has to be given by a person who has recovered from COVID-19. It's not like any other drug which can be sort of bought off the shelf.
Right.
And that is why it's important for individuals who have recovered to come forward and be willing to donate their blood for this noble cause. I think that's a very important thing. There was a lot of enthusiasm in the beginning. We had a lot of people who actually volunteered and came and donated the plasma. But over the last few weeks, it has really come down. And that's why I feel that we need to sort of revitalize that campaign so that people again start coming forward to donate their plasma. Sometimes it can really make a big difference. And there are some studies now which have come recently published which suggest that it could be useful as a part of the overall treatment in COVID-19.
Right. So far in the country, plasma therapy is only being given to very critical patients. Do you believe that perhaps it could prevent patients from slipping into a critical stage if it's given even earlier?
So I think even in moderate to severe, those patients who haven't really gone onto a ventilator but are going in that direction, plasma therapy may help in that stage also, rather than giving it very late. Right. And like I said, the utility is more when you give it early, because at that point in time, there are no antibodies in that individual who is sick to fight the virus. It takes some time. Like we just said, it can take up to 2 weeks for the antibodies to form. So giving it early really helps to boost the immunity. So it's a fine balance. You don't want to give it too early when you really don't need it and the person may recover on his own. So when you are having a moderate illness and going more towards a severe illness is the ideal time that you can give plasma therapy. It can also be given in more severe cases, but I think the earlier you give it, the better it would be.
All right. We once again urge our viewers to join NDTV's Donate Plasma Save a Life campaign. As Dr. Guleria has reiterated, it can really go a long way in saving a life. Dr. Guleria, OPD services across different hospitals are going to be resuming. What are the kind of precautions that patients and doctors should be taking?
So we have started our OPD as far as the All India Institute of Medical Sciences also is concerned. We are doing it in a combination of trying to see that we don't have too much of a crowd, because social distancing becomes very, very important. We had an OPD in AIIMS which used to be over 13 to 15,000 a day, and that is not possible now in this COVID era. So we've moved on to what we call teleconsultation, and we try and see if our follow-up patients or if new patients can be advised through teleconsultation. If that cannot be done, then we give them an appointment for physical consultation. And when they come, they go through a screening process where we check to see that the chances of them having COVID is low. And doctors then take proper precaution in terms of physical distance, isolation, wearing an N95 mask and a face shield to protect themselves, at the same time to be able to examine the patients. It's also a lot of daycare procedures also have been started, and that becomes a big challenge, because you don't want that a patient who goes in for a small procedure should have the infection and expose everyone in the minor OT to that infection.
Right.
So those things have to be developed. Protocols are already there, but hospital infection control strategies have to be developed aggressively in this new era of COVID-19.
But I think the bottom line is that if you are a patient who has, another severe condition, OPDs are now open, and it is encouraged that you do seek treatment for that. I want to also ask you about, since we've talked about cures, I also want to ask you about vaccines, because there's been a very interesting development. The World Health Organization chief scientist Soumya Swaminathan has said that AstraZeneca's experimental COVID-19 vaccine is probably the world's leading candidate, which is the vaccine that's being developed by the Oxford University. How would you place the timeline for the world getting a vaccine, Dr. Guleria?
So there is a huge investment and research going on to develop a vaccine as early as possible. A lot of things are being done in parallel rather than in sequence, which would have ideally been done in the past.
Right.
In the past, you would first have done developed a vaccine candidate and then looked at its efficacy, safety, and then looked at manufacturing. But many companies now are actually doing everything together so as to save time. And this is a little bit of a financial risk, because you may invest in making a vaccine, but it may not turn out to be that efficacious when you start doing the trials in parallel. And therefore, the vaccine strategy would have to be changed then. The challenge for any vaccine is that it has to be efficacious. It has to be able to show that this vaccine gives you good amount of immunity to fight against the virus. It also has to be safe. There are vaccines which have caused problem in terms of reactions, which have been very severe, and therefore the safety of a vaccine which is given to normal healthy people is paramount. After that, you have the whole issue of mass production and prioritizing whom to give the vaccine and whom not to give the vaccine in the first stage, where limited doses will be available globally. So I think these are the challenges, and this will take, in my mind, at least 6 to 9 months for all of them to be met. And therefore, I think maximum, the earliest will be by the end of this year or by the first quarter of next year.
All right. So end of this year, first quarter of next year, and a whole host of variables at the moment when it comes to India getting a COVID-19 vaccine. Appreciate you, Dr. Guleria, for sparing the time of day, so patiently answering all our questions. Thanks so much for joining us.
Thank you very much. Thank you.